So thank you so much for joining us and thanks for coming back. For those of you that were here with us earlier today, you already know me. And for new people, my name is Alissa Terry. I'm a genetic counselor in upstate New York and the project manager for NIMAC. I'm really excited to be talking with you today about the importance of collaborating with diverse stakeholders to co-develop effective systems of care. For this session, I'm joined by my colleague, Molly Martzke from the National Genetics Education and Family Support Center. I'm going to let Molly introduce herself in just one moment. We will be using breakout rooms and interactive activities today to enhance our discussion of this topic. Molly and I do not have any relevant disclosures. I'm going to welcome Molly now.
Thank you, Alissa. And everybody else for joining us today. I am Molly Martzke, the Senior Program Manager at Expecting Health, where I get the great privilege of overseeing the National Genetics Education and Family Support Program, which we call the Family Center. I was so excited when Alissa contacted me about presenting on collaboration and co-production. This is something that we work on at the Family Center and something that I feel very strongly about as an agent for systems change. So as the parent of 2 deaf children, I've been able to bring that lived experience and perspective to teams that I've been a part of over the years and really see how that can be an effective method of change. So before we get started, I wanted to just give you guys a general overview of what this session will look like. Like Alissa said, we're trying to make it as interactive as possible. So we will have polls, word clouds, and a collaborative activity. I also encourage you to ask us any questions or leave comments in the chat. We're happy to try to get to those because really we feel that this is a topic really best explored together, really collaboratively, if you will. So what I'm going to do first is go to a couple of our polls. We would love if you could answer a few questions for us. We have 3 here. So I'll let you guys get to that.
Yes, Molly, the poll is up and launched and I can see people are starting to participate.
Thank you.
We're having to think a little bit about this one.
That's all right.
So I can see the answers are still coming in. Molly, there's a pretty strong front runner for that first question about how familiar people are with the concept of co-production of services. So you might be surprised along with everyone else about the answer to this.
Now I can't wait to find out.
I know.
What a nice tease you had there.
I mean, you could leverage your social power here and get the answer, I suppose. And then the next poll is much more evenly split. But okay, the answers or choices are starting to slow down. So I am going to end this poll in 3, 2, 1. Here we go. And now Molly and everyone else, we can see the results.
Perfect. Okay, so not a lot of people are familiar with the concept of co-production of services, which is completely fine. I am going to cover that, talk about that a little bit. Then when we ask people about, in your area of work, how much of a priority is it? So, it was kind of split, I guess, a third for critical and high, and then medium to low. Again, we understand that this is a concept that goes up against a lot of competing different ideas and responsibilities and tasks. So it may not always be the easiest thing to get done. And if people have the resources, knowledges, what they need to bring together a diverse team. So about a third said yes, 20% said no, and half of you said you weren't sure. So we hope by the end that we will kind of, help move some of those answers a little bit more, I guess. So what I'm going to do is jump right in and start talking about co-production theory. So I'm going to use co-production, just because that's the name of the theory, but I wouldn't get so stuck on some of the words because, you know, it really can be co-creation, different things like that. It's really about collaboration and trying to bring different stakeholders together to kind of work on some topics and see things differently. So this concept of co-creation has been central to a variety of service industries for, you know, several decades now. It's used as a tool to fuel innovation and customer satisfaction. Co-creation acknowledges that the successes of any given enterprise really depends not only on the expertise, assets, and core competencies of that service provider, but that's also on the knowledge and perspectives of their target customer as well. So again, if you think about Nike and them making shoes, you know, it's not only their knowledge about how to make shoes, but whether people will go and buy them or they like to wear them. So really co-creation extends beyond consulting and with consumers or their, you know, or their participation about buying it. It's really about integrating customers into that process of product and service ideation and execution so that their unique perspectives and cooperation may ultimately drive value for both the producer and the customer. So that's where it is on the consumer side. And I think a lot of us can kind of see that. What I really want to talk about is how does this translate to healthcare or systems of care? So I have a little bit up there. I actually, and I think Fred was going to throw this link in there, but you know, the AMA Journal of Ethics really had a couple of great articles on this about how healthcare has been slow to adopt co-creation. Historically, patients have been considered sort of passive recipients of services provided to them by those in the healthcare industry. But there's really a growing body of healthcare literature that suggests that a collaborative approach to medicine can really result in improved efficiencies and outcomes, increased patient satisfaction and trust, and really a greater capacity for medical research. A variety of models for incorporating the patient perspective have been proposed as well. Models that really engage patients as partners from the onset of services development, or those that leverage patient communities as support groups. They provide frameworks that can enable the healthcare industry to better utilize patient perspectives. Meanwhile, patients ultimately benefit from more relevant and optimally designed services that are better tailored to their specific needs. Next slide. So, you know, why should we consider families as stakeholders? And I also want to mention that I will often say families when I'm talking about other stakeholders. This is because the work I do at the Family Center is really focused on families, but please consider when I use that term families, I'm really meaning it as a variety of stakeholders with different lived experiences and perspectives. This could be adults and adolescents living with the condition, as well as, you know, other caretakers or family members that are really integral in that care of an individual. So you want to make sure there really is that diversity of opinions as part of the team. But a couple of reasons for including families is by actively engaging families as equal partners in their child's healthcare and decision-making has really been associated with reduced unmet health needs, fewer reported problems, accessing specialist referral, lower out-of-pocket expenses, and improved physical and behavioral function in children. So families really have that unique and intimate knowledge of how a genetic condition impacts a family beyond the diagnosis. So they really have that lived experience of how the healthcare system can exceed or fall short in meeting their family's needs, really what gaps exist in current systems and how to prioritize opportunities. So I'm going to interject a point right now about different perspectives and designing a system and the why. So what I really want to say is I'll be talking about, you know, including families or other stakeholders at the table, but as we were coming up with this presentation and had some conversation, it really isn't about building a system that's really just built by families or a system that's built by providers or payers. I said I wouldn't really want to participate in any of those systems. I'm looking for a system of care that's been really taking all those perspectives and trying to, meld them together to make the best system. So it's not just from one point of view, but really it's that culmination of everybody's viewpoint. Next slide. So there's many points in the system that families and a variety of stakeholders can become involved. So from planning and design to delivery to assessment, I've included some of those areas as examples under each of the categories. The thing to think about is really integrating different perspectives all along the continuum. It's not just about finding a place where you think maybe a family's perspective is like, let's say what their office visit was like, but it's really about trying to embed them from the start of the process. So it's not asking them at the end what they're, do you like what we've already designed? But it's really trying to include them at all different points. And I will get to a pretty specific example for you in a little bit. But first, I am going to ask about a Zoom poll. So asking if you've ever participated in an interdisciplinary team. This one's quick. This is yes, no, or not sure.
That's right. This one's real quick. Very popular with these polls, Molly. You've got 100 people participating in them.
Thank you, everyone, for your participation. Yeah, we would have loved to. We know that sometimes it's hard to stay engaged on virtual meetings, so we tried to sprinkle in some things so we can kind of gather how the room is feeling about issues.
All right, well, I think you've got everyone with a clear answer has answered. So I'm going to close this poll in 3, 2, 1. And here are your results.
Great. So 83% have said yes. So that's fantastic. Again, hopefully you have experienced some teams that were really cohesive and came up with some inventive and, great ideas to help solve some of the problems that you were working on. I also wanted to talk a little bit about maybe a word cloud I thought we could do right now, about what some barriers that get in the way of these teams working well.
Okay, so do you want to start with barriers or keys for success?
Which one do you have ready? I can do either one.
Okay, we can do them one in a row. So let's do keys for success first.
Thank you.
And then we'll use the same link to do the barriers question, but we'll get the results of the success first.
Perfect. And
I'm
going to grab that in the
what?
chat.
Yes, Molly?
Grab that in the chat, I said?
Yes, the link is there in the chat. If you can't access the word cloud in chat, then go ahead and if you can't access the link, you can just answer in chat too. But if you can access the link, you get to make a cool word cloud. And Molly, I'm going to, or Alissa, I'm going to take away the screen sharing so I can show this word cloud as it's coming in.
Yep.
All right, there it is.
Just so you know, I love word clouds.
I heard about this.
Yeah,
so very popular.
So again, communication, right, is staying right up there. Definitely a key to success of working in some of these partnerships. Open-mindedness, I just saw ease of participation. That's a good one too, right? Is if they're easy. There's some curiosity. So if people come curious, some mutual goals, humility. I think those are all great.
Cool. All right, I'll paste the second question in chat, but actually will be the same link.
Okay.
And the question here is, in a word or two, what are some barriers that get in the way of these teams working?
Oh, yes, communication or miscommunication, egos, red tape. lack of trust, silos, lack of resources, all good answers of some barriers that get in the way. Someone said stigma in the chat. I like that. In plain language. Yeah, very, very good. Thank you, Erica. Thank you for doing that. So once we get back, Alissa, if you'll share the slides again, then I'm gonna go and talk really about, you know, there's lots of examples of successful co-production or co-creation. One that I'm going to share right now is from the Virginia Newborn Hearing Screening System, their EDI system, so their Early Hearing Detection and Intervention. They implemented 136 family educator site visits. So that 136, if you're not from the EDI world, refers to the EDI guidelines that a child should receive a hearing screening no later than 1 month of age, a diagnosis no later than 3 months of age, and entry into early intervention services no later than 6 months of age. So Virginia's 136 Family Educator Project. So they're parents of children and young adults who were diagnosed as deaf and hard of hearing, who can commit to, you know, 16 to 20 hours a month to their project. The role was really around 3 prongs with the following responsibilities. So they were supposed to visit local hospitals and audiology practices to conduct short surveys and discuss the processes used for testing and for sharing hearing testing results with families. So they were really there to, again, meet with hospital staff or audiology clinics and talk to them about the process and how to share results with families. You know, secondly, they were supposed to maintain contact with stakeholders that following the initial visit and acquire information about and distribute resources regarding hearing differences and services to professionals and families within the region. So I just want to point out, so these were family educators. So, you know, families that were trained to provide a couple of services. So they were not only meeting with families, which I think sometimes we traditionally think of, you know, the value of that peer-to-peer family support, but they were also meeting with hospital staff to perform trainings for hospital staff or audiology staff. So, and one of the things that they had heard back was a hospital hearing screening coordinator actually requested family educators return to their hospital to share, you know, that educator's experience with her own child with the nursery staff. The screening coordinator shared that staff were afraid of giving bad results to a family, and that hearing that educator come there and offer some of her training and her personal story, that it really helped them be more willing to let parents know that their child, you know, having a do not pass hearing screening, that if the staff were able to hear the successes of this story, that they, that only that family educator could share. So I thought that was, again, an interesting thing. And really, one of the main metrics that the state is working on is loss to follow-up, that time when families have a positive screen at birth, but don't necessarily come back for a rescreen or additional testing to receive the diagnosis. So the hospitals that participated in the 136 Family Educator Project actually had a decrease of about 4.5% in that first year that they participated. So they went from about 51% down to 46%. So that's a real life example of someone in your region. So, and I know Dana's on this in this group, and Dana Yarbrough, and she would love to share more about that project, I'm sure, and others. So, but if we want to go to the next slide, you know, here is something that the Family Center came up with. We recognize that this work is hard, really, and you know, it's not a linear trajectory. It's really all about relationships. So you can be in a really good point. Let's say you think you're at commitment or leadership with working with family engagement, but then something happens, such as people change and you're at a different point. So It's more important to we think it's more important for you to understand really where you are and where you're trying to get, rather than looking at this as a scorecard. It's really more about trying to understand where you're at in the process. And then I'll just jump to my last slide. And, I really just wanted to talk a little bit about the Family Center really works with the RGNs. So we work with NIMAC and the other RGNs to really ensure that families are prepared to participate in leadership roles, because again, as we look to incorporate them more and more, it's important that they have some of that basic understanding of systems and training and stuff like that. And, we've talked with Alissa and NIMAC of moving along that spectrum over the last year. And again, we've talked with her and her team to discuss family engagement, areas that they're focusing on, and maybe provide ideas for accomplishing what their goals are. So I'm going to hand it over to Alissa so she can share us some more examples. I know that was a ton of information and we could have spent hours on this, but we're just trying to give you a taste of this. So Alissa.
Yeah. Thank you so much, Molly. So if you heard me speak this morning, you already heard me talk about how much NIMAC values and uses collaboration and co-production throughout our work. This meeting is one great example of how we strive to work directly with families from across the region. Molly and I have talked about NIMAC's work with the Family Center. We also collaborate with our regional family-to-family, parent-to-parent, and family voices organizations. We engage with regional families on everything from our website, social media, and the plans for this meeting to NIMAC teams, projects, and the NIMAC Advisory Committee. The NIMAC teams in each of our 10 jurisdictions are also a great example of collaborative efforts. As I described this morning, we invite stakeholders with all different perspectives to be members of these teams and help lead projects. We currently, this morning, heard from 7 of the NIMAC teams, and I would like to share some other thoughts from them. So I'd love you to hear directly from some of these team members about their experiences and advice about collaboration. So in this video, you'll hear from Lisa Richard, Maria Isabel Frankenberg, Dr. Norma Arciniegas, Rosani Sanchez, Shami Carr, and Lynn Perry about their experiences with collaboration.
My name is Lisa Richard, and I work for the Center for Family Involvement at Virginia Commonwealth University. And when thinking about how to design better systems of care, I would always have to say include the families, engage the families in the decision-making process. It's so important. They're the ones that are going to be accessing care. They're the ones that are going to be following whatever care plan is designed for them. And how do we design a better system of care if we don't include the families? I know that there have been times when I have been given things that I need to do for my own children, and I didn't quite understand what I was supposed to do. I work in rural areas and health literacy is an issue. And if you're not looking at the population that you're trying to help and engaging them in the decision-making process, it's just not going to work. They're not going to do what they need to do or follow up as they're supposed to, especially if they don't understand it. Genetics is really complex. And so I would just have to say, if you can engage the families, include them as much as possible, that's what I would do to really help inform the decision-making process for a better healthcare system.
Generally speaking, we have been talking with very busy people who usually wear many hats. For example, in the Virgin Islands, we have people who are still providing services as physicians, as therapists, but they're also the dean of the School of Medicine, or they're also speech pathologists and the dean of the School of Education at the same time. So we understand that they're very busy, but they come to the table, and at the same time, we're going to have families at that same table during a quarterly meeting. So it's a chance for them to listen to each other around the specific objective of bringing the families in the Virgin Islands and in Puerto Rico the best genetic services possible, or thinking about how that can be done. So it's an opportunity, I think, for everyone to formulate ideas and to formulate a plan to move forward.
Even though this is a small island, many people don't know where the geneticists work, what services they provide, and what kind of help they can receive from a genetic service and a genetic counseling, which is very important.
Okay, due to the lack of genetic services on the island, it is very important that families have access to the necessary information to know where, when, and why they need genetic services, what their options are, and how to get what their children needs. Therefore, we have dedicated ourselves to empowering families so they know the basic concept of genetics, the implications, where to receive services, and their rights. This way they can advocate for themselves and help other families that are going through the same circumstances. Building trust between healthcare providers and families is essential to our work.
NIMAC's role as a coordinator and as a repository and as a regional site has done nothing but bring an abundance amount of information, resources, and hope. And I think that working with NIMAC, with the families, they can only speak to, again, the quality and the possibilities of what's going to happen for them and their families. So it's just a huge benefit for the Virgin Islands to work with NIMAC. And again, I keep going back to that sustainability, that is the ultimate goal, and that's how the families will benefit.
All of us come from different aspects of the system, and we should make sure that all parties are represented at the table when decisions are being made about, a design or redesign. We have a phrase that we use, particularly in disabilities community, it's nothing about us without us. So don't design systems for us without us at the table. And not only at the table, because I've sat on plenty of committees where you have somebody from the disability community, a parent or somebody on the committee, but they don't actually have an active role. You have to make sure that families or different parts of the system have active roles in that redesign or design of the system.
Thank you all again to our collaborators who lent their stories and perspectives to share today. So I'd like to do a quick check-in with you about how you're feeling about your own skills for collaboration. So this is actually a scale that we use at NIMAC to check in about how some of our collaborators are working together. We're going to ask you some of these questions, and we're going to split into two groups to answer. So I'm going to ask some of these questions to our families and family advocates, and then separately ask them to the rest of the audience. So maybe many of you work in teams, as we saw in the very beginning when Molly asked. Many of you work in teams or collaborative groups of some sort in your everyday life. So maybe you're on one of our NIMAC teams, maybe you're on an interdisciplinary team at work, maybe you spend a ton of time as a member of your own or your family member's healthcare team or your child's education team. What we're going to ask you to do is please think about a situation where you are working in either a formal or informal collaborative group right now, where there might be different people with different agendas, and the outcome really depends on input by all those members. We want you to think about how you feel about your skills when working on those teams. We acknowledge that how you rate your skills in any group work is definitely influenced by the culture of the team and the system influences, but it's also influenced by relational skills that we have, and improving our own skills can be key to having the type of outcomes that we desire in those interactions. So you're going to see two polls come up now. We're asking you to rate yourself from 1 to 5 on each skill. Families and advocates, please use that poll, and all other attendees, please use the other poll.
Okay, Alissa, I'm seeing answers coming in. Shall I share the answers as they're coming in now?
Sure.
All right, it means I'm going to take your screen sharing away.
Yep.
And take it over here. So can you see those like bouncy lines there showing how people are rating their skills from poor to excellent?
So as you guys might guess, one of the reasons that we split the groups differently is because we were curious to see if families would feel strong in different areas than the rest of us feel strong. So we're kind of trying to figure that out by asking the question this way. Some of the patterns look pretty similar, but looks like our other stakeholders are maybe struggling with constructive feedback, which is certainly a challenge for all of us to figure out how to do that well.
Yeah, and listen, if anyone's wondering how to submit their answer, there's 2 links in chat. So the first link is for if you're a family or an advocate, and then the second link is for any other stakeholders. And that's why there's 2 results being shown.
Thanks, Erica. We'll give it another minute to see if we see these bumping around anymore. It's cool to see them moving. All right. All right, guys, we appreciate your input on that. I think it's important for all of us to be able to be a little self-reflective sometimes on what we're good at and what we could improve in. So I'm going to take that back. Okay. Okay, so now we're going to ask a slightly different question of you. And that is, if you could increase your ability to do one of these, which would make the biggest difference for you in terms of feeling successful on those teams? So again, you're going to see that question come up separately for families and advocates, and then a different poll for the rest of us. And Erica, I'm not sure if that's a Menti or a Zoom poll.
Actually, in this one, we made it a Zoom poll, and there's only one, because this is for everyone just to think for themselves.
Okay.
So what I'm seeing here are answers coming in, and then I will give countdown and share those results. All right, we're still seeing people answering. That's a
great, really
thoughtful question.
Yeah.
Or thought-provoking question. All right, I think I'm seeing the answers slowing down. So if you don't get a chance to answer, you can obviously continue this conversation in chat, and it will continue into the next section. So I'm going to close this poll in less than 3, 2, 1. And there are the results.
Great. All right, so it looks like promoting effective communication among members is the clear front runner here. I don't know if that's just because it was #1 or if that's how people really feel. You gotta always wonder that, but we really appreciate you sharing with us kind of where you feel like some investment of work and time could be beneficial. So we really thank you for contributing to that. We're now going to spend some time thinking and learning about how to build those critical essential skills, and I'm going to hand it over to Erica to lead us in that.
Okay. So all right, I'm in the spotlight. Hello, everybody. So Fred and I work a lot with the NIMAC team behind the scenes here to help design this meeting to be collaborative and meaningful and interactive. And we do that. The reason we're passionate about this is because our background is as team and leadership coaches, and really focusing on these multidisciplinary, cross-discipline collaborative type of environments. And so we're going to just share with you in this next little bit of time, about 20 minutes, a tool that we think is foundational for building a bigger foundation for better collaboration really, no matter how you answered that poll. And I'm going to give you a heads up that for this exercise to work, I'm going to need a volunteer, or maybe a pool of volunteers, but from which one person will be very brave and courageous. And what you will get to do in the front of the room is for 1 minute, talk about a collaboration or some type of collaborative project that you're involved in that you are feeling passionate about right now. Now, you might be feeling passionate because something is really not working. You're not feeling heard. You're feeling stuck. You're feeling blocked. You're feeling whatever. It might be because of that, or it might be because something happened that just really is feeling great and it's just lit up for you recently. So I'm going, oh, and Fred has put in chat, we are going to pre-recruit volunteers. It says, type yes in chat if you could talk for 1 minute about something you are passionate about, and the rest of us are all going to have a job too. And that is going to be amazing listeners of this person. I see Jessica jumped in right away. And the rest of us will have a job, and I will guide you through in a structured way how you're going to do that job. And the first thing I'm going to do is share, so thank you, Jessica, and thank you, Linda. Thank you, people who have volunteered. I'm going to share with you an image that I found to be very helpful when thinking about collaboration and collaborative working together with other people. Just a simple diagram. If you imagine that the two colors of triangles are two different people who are in a working relationship or in a conversation. At the top of the mountains here, on those tips, are like what somebody is saying, right? And so a lot of times when we're listening to each other, it feels like I am over here on the tippy top of the yellow mountain and I am making my point. I need someone to believe me that this is really happening with my kid. No one is believing me, right? And then the other person is on the top of their point, saying whatever they're saying, like, it's not my job to figure this out, or I'm sure that there are tests available. I don't know what they're saying, but they're not saying, I'm not feeling very satisfied. So I'm over here saying this again and again. And this conversation back and forth can just go on for a long time, and it can make people feel like there is not common ground. So the line, the horizontal line, you can think of as what's above the line and below the line. So above the line is what's visible and what you know about yourself, about the other person that you're listening to or working with. And then what's below the line is a whole lot of stuff that maybe you don't know about. Now, Fred and I work in the realm of improvisation theater, and that's all about co-creation. And people think that people who do improv, it's like magical. How are they so creative? They're not creative, and they don't come up with great ideas just because they're bouncing around on the top. People come up with great ideas, whether it's in theater or whether it's in working groups, collaborative groups, by dropping down and creating a bigger base of understanding from which to create together. And so the beautiful zone of true co-creation in this image would be in this orange triangle on the bottom, where if the other person is the yellow mountain, you listen and understand them more and more and more. So more and more of them become visible, and there's more space that's going to start overlapping with your triangle. So if you're the red mountain, well, you may not know it consciously, but you are sitting on top of your values, what you care about. You're very familiar with that. So as soon as something starts coming where there's an overlap, it's just instant, the desire to work together, to communicate together, and to care together, and to create together. So the rate limiting step, I think, and in my experience, is that we're only seeing the little tippy top of what someone is saying, and we're not taking the time to broaden that base from which we can work. So you can keep this image in your mind, and we're going to do an exercise together. And the exercise together is going to involve finding out and seeing how much of the bottom of the mountain that we can create, that we can hear together with only about a minute of meeting someone and having them talk. And I'm going to change the slide to show you the model that we're using, that is from a friend and colleague, Kat Coppett. And It's called deep dive listening. She's got an acronym. So dive being data, intentions, values, and emotions. So we're going to have someone share as a volunteer, and we collectively are going to be listening for each of these things. We're going to listen for the data. What are the facts? I have a kid, they're 5 years old. They've been in this program for 8 years. They've only been seen twice by a specialist. Okay, data, these are the facts. Intentions, why are they telling me this? Okay, I think they're telling me this because I am paid to help them out, or because they feel like I will listen to them, or because it's they believe it's my job to help them figure this out, or they have hope that there's a solution that I have access to resources. Those are intentions. Why are they talking to me? Why are we having this conversation? Values. What is important to them? This can be the heart of it. What do they care about? What's important to them? What are they valuing? Conflict, if there's conflict in an interaction, it's because people care. If people didn't care, there wouldn't be a sense of conflict. One of the most direct ways to get directly to an overlap zone in a conflict is to be able to name what is important to this person. You care about finding a solution that works for everyone. You care about your son's long-term health. You care about everyone being included in this decision. You care about trust. Trying to get it down to core care and values. And then finally, another thing you can listen to is emotions. So that's naming the emotions. You're frustrated, you're sad, you're a little bit hopeful, you're exasperated, whatever the emotion is. So what we're going to do together in the main session is I'm going to take down this slide because Fred's playing along here at home and has put this in chat as a little cheat sheet of those same things. We're going to bring up, so if Jessica, are you still willing to be a volunteer here to get listened to by 100 people all at once? Unmute yourself if you are, or unmute yourself anyway, so I can.
Yes, I will. Yes, absolutely.
Oh, wonderful. All right. And is it okay for you to be on screen so we can all see you?
Yes, I'm in my office, so sorry.
There you are. We see you now, Jessica.
And if you tip your your screen down a little bit, we can see your face.
There you go.
Wonderful. And that's not necessary, it's great. I can see the top of your head. And honestly, sometimes listening without seeing someone can be very powerful. And there's already some thank yous in chat here thank you for volunteering, because this is going to be real and live, and we have not met, we have not rehearsed this, but we're going to do this as a demo to see how it works.
Sure.
So what's going to happen is in a moment, I'm going to ask you, and I'll time this for a minute for you to share about something that's going on that you care about. Actually, Fred, could you be in charge of timing? Is that all right? Okay, thank you. I can see you, Fred. Yeah, okay. You're going to share about something that's very true for you now, no backstory. Just talk to me like I am someone that you think is going to hear you, and just lay it out. Like whatever is most important to you about this, whatever you are most strongly feel about, like it could be like a rant, maybe like either a negative rant or a positive rant.
Sure.
And I will cue you to do that. And then this will be a little segmented because I want room for everyone to play along. And then as Fred says, as the audience. So if you're playing alonghand, wiggle your fingers so I can see you, or type in chat like, yes. All right. Oh, Selby. Yes. If you knew we were playing, you would volunteer too. It is so fun. Okay. Yay. We've got some listeners. All right. So I'm going to have you do that. And then I'm going to call out to ask first for people to share data that they heard. We'll get a bunch of data in chat. Then I'll ask for people to share intention, then values, then emotion. So we're going to get the chat filling up with each of these things. If you're listening to this, you might even want to jot something down, but try to remember something from all of those buckets as you hear it, and then we'll collect it in chat. then I will ask the group which they thought was most important to you to be heard about. And then I'll pick from that bucket and I'll reflect it back to you, what people have said that they heard you say, and then you'll have a chance to respond. All right, so Jessica, some other people wish they were you, but it is your turn now. Lay it on us all. You're unmuted. Tell us what's going on.
Okay. Well, first of all, hello, my name is Jessica Haas. I just want, so I'm acting like I'm talking to you, correct?
Sure.
Okay.
Yep.
So, I just want to say that, I live in West Virginia. We are a very rural state. And my big passion that I see right now is that we are lacking resources. Resources to help our families here. I work in the NICU, especially in the southern part of West Virginia. One thing that that we have noticed is working with ISONG to get certification for genetic nursing for myself is that we have a lack of education through the nurses, through the frontline staff in education for those frontline staff. None of the nursing schools except WVU in the northern part have any type of education for the nurses in their basic undergraduate program. West Virginia has the majority of associate's degree nursing, and this is only taught in the bachelorette program. We don't offer a PhD or an MSN program to offer that except at WVU. So there's limited resources there that we noticed. And I think that's very important as things are going on. Also, congenital defects are increasing in our area, especially among the neonatal population. We've noticed that. And one thing we noticed is there's no congenital defect database, an active one. It was stopped in 2002. So there's no way for myself as a research nurse to kind of pull that information to work with Dr. TC, for example. Another thing.
That is time, Erica, if you want to keep
Wow.
the time. Thank you, Jessica.
Fast. Sorry.
Yay, Jessica. Thank you, Jessica. All right. So, and there was a lot of this first category, data. What did you hear that was data? Go ahead and share it in chat. Thank you, Christina. So you're already on it. What are the facts? No opinions, no judgment, just facts. This is great. People heard different specifics. Fantastic. And this is great. It's amazing. We all were listening for the same minute, and there's different things that we cued in on. All right, let's try the next one. Intention. Besides me asking Jessica to do it, why is Jessica telling us this? Some of this requires some reading between the lines. That's fine, because I'm going to say back to her this, and we're going to reality test it. And Jessica, it's totally okay to be reading along in chat and taking this in, that this is what people heard. All right, beautiful. Values. What is important to Jessica? Underneath all this, what does she value? What does she care about? What's important to her? What drives her? What's that base of the mountain that all of this, everything else is just evidence of? What does she care about? And it's totally fine if there's some overlap, right? This is not meant to be like a formula. Beautiful. All right, I'm calling these out because they're in the clever acronym order. This is not like a reason they have to be in this order, but let's try the last one, emotion. What emotion was she expressing? Jessica, it's going to be so fun to hear what you think about this, because you're seeing there's a lot coming in chat. And you see a huge range of emotions, right? A lot of emotions in 1 minute above the surface. All right, I hinted at this before. So look at all, I as the very well supported listener here in this scenario, have about 150 things to choose from of what I would say back to Jessica to acknowledge that to give her the sense that I heard her and I care about what she's expressing at the top of her mouth. When you're doing this with people that you can do this all day long, what you may be tempted to reflect back kind of your own way of thinking or what you think is what important, or maybe what you agree with or disagree with. The key to dropping the deepest in an effective sort of building with someone else is to think about what do they care about the most. So Fred's going to launch a poll that asks you, what do you think was most important for the speaker of those 4 categories? What if sometimes people just want to hear that you heard the actual facts? Often they want to hear that you hear their good intention. Sometimes the fastest way to connect is to demonstrate directly that you're aligned on the shared values. And sometimes the most direct thing, if there's a lot of emotion, just acknowledge that emotion, because you're not gonna get past going around it. This is all a practice of going straight into it. So I'm seeing a lot of the results coming in here, and I'm gonna scroll back in here in chat. So I see what's coming out as strongest is intention for this particular listening. So I'm going to go back into the intention part of the chat, and I'm going to choose something here that Jessica, this is where I'm going to have you be back on, if you can unmute, and see what I can do to acknowledge your intention, and then you can say if I've got it or we've got it. Jessica, your intention here is you care about families and you want to make change. Your intention is that, your intention is that you want to see improvement, you want to make change, and you're telling us because you believe that by telling us that you can this is part of a process of making a change to improve these conditions.
Correct. Yes, collaboration, I believe, is the key. Process change, quality improvement, anything to help to get more people together to make change. Improving care for neonates is my #1 priority.
Yeah, so improving care for neonates is #1 priority, and you really believe in collaboration.
I do, yes.
And that's what underlies, and I could add some more things that underlies the frustration that you have. It's what underlines the passion that I could hear in your sharing. Is there anything else that you want to add? I mean, I don't know if you've been reading chat. Is there anything in there that what just nailed it for you?
I think everybody is pretty much on target with improving the quality of care and resources. It's hard and frustrating that it got to be tiring for WVU to try to have to do everything for the whole entire state. Dr. Burke and TC, for them to do telehealth and then have to tell us what tests to run, and them have to come down here once a month. And run their own clinic. That's got to be just really hard on them themselves. And then take care of the entire state. There has to be better resources to help them. And that's one of the main things, it's got to be tiring for them to collaborate, just to help them out.
Thank you, Jessica. We have just a minute here. I want to just acknowledge something that Jessica just did, and that you all did together. Fred's we're gonna do 2 things at once here. We acknowledge the deeper base of where Jessica was coming from. And did you notice in that last share, she started coming across here and acknowledging how frustrating it must be for us, how much she appreciates us. She naturally started opening up beyond her own frustration and that position into a lot more of the shared area. Just to call that out. And the last poll we have for you. So just to assess yourself, what do you tend to listen for? If you were listening, what was easiest for you to listen to? What's your bias towards what you're listening to? And then the second question is, given that, and given what's out there in the world and how people are listening, what would it make the biggest improvement in your collaborations if you listened more for? And in a moment, we'll share those results. Yeah, and we're seeing that there's a difference between people's bias for what they tend to listen for and what they kind of want to acknowledge, and then what is probably more valuable for the purpose of creating collaboration with other humans who are messy and emotional, of what you could courageously acknowledge that would build that bridge and sort of make all your little mountaintops become a mountain range together and drop that level. So Fred's showing the results. There's a bias in the group, towards listening towards data. And it looks like there's a spread here, but intention is the front runner there of what will get you the most mileage for all the things you could listen for. So your bonus assignment is to carry this tool forward for the rest of the meeting. And sometimes you're going to be listening to people tell their story. Maybe listen first, give someone the grace of your acknowledgement, and see what happens next. All right, thank you everybody for participating. Thank you, Jessica. Feel free to share your comments in chat. And it is time for us to move to the next part of this segment. So I am going to pass to Molly. Molly, take it away.
Thank you. Honestly, that was a great activity and I really appreciated that. So I just wanted to, and you guys can look at this, but really honestly, this is just some key values for collaborative teamwork. So we kind of heard it through our activity. We've seen it, it's really clarity, talking about what you mean, efficiency, positivity, trust, and accountability. So yeah, again, really some key values for a collaborative team, but thank you for being part of this team. And I know Alissa is going to talk to us next about what's going to happen over the next couple of hours today and tomorrow.